Thank you all for coming out on this fine March afternoon. And you know it's March in New England because tomorrow we're going to have a snowstorm. So it never ends. It never ends. And then it's summer. So what I'm going to do a little bit, this is going to be a little bit like seeing a bunch of movie previews. It's going to be a little taste and a flavor of what's been going on research-wise, but it's not going to be the full movie on anything. So it's really just to give you guys a little bit of an idea of what we've learned over the last decade. And a lot of the information that I'm going to talk about today directly comes from research done by Dr. Kostenbader and Dr. Feldman. And Dr. Kostenbader actually gave me, some of the slides are actually her slides because they highlight some of the research she's done. But I think you'll see how she's come up with some very interesting findings. We'll talk a little bit about predictors of flare. We're going to talk about causes of lupus, predictors of flares, and we'll focus a little bit on kidney disease and pregnancy, just to give you a flavor of what's been out there. So someone had asked before about like triggers and what causes lupus, and see, there are a bunch of things that happen, and we'll talk a little bit about, there's genetics. We've talked a lot about the fact that lupus is more common in women, and it's more common in women during their childbearing years. So definitely there's this impact of reproductive hormones such as estrogens on lupus. We know there's problems with the immune system. And then there's environmental factors. We keep talking a lot about sunlight, UV light, and sun exposure, and how that can trigger lupus flares, cigarette smoking, and other what we call environmental factors. So this is, when we talk about genes, this is an old study really from almost 10 years ago, 11 lupus cohorts combined. And at the time of this study, there were maybe 7 or 8 genes that were had been discovered that could predispose to lupus. And it turns out that every year we're finding more and more genetic variations or genes that contribute to someone's risk of getting lupus. And the last article I could find said that there were 50 genes identified as being associated with lupus. So what that means is it's not one gene. So if you, other things we inherit by one gene, it's not that. It's a bunch of little SNPs of genes that vary amongst all of us, and each one of those can contribute to your risk of getting lupus. So it's not one specific gene, but it's a bunch of different variable genes. We also know that, as we talked about estrogens, that estrogens predispose to lupus. So we talked about the fact that it's more common in women. And what Dr. Kostenbader actually found a number of years ago is that earlier onset of menses, so the younger you are when you get your first menstrual period, use of oral contraceptives, which by and large contain estrogens, and hormone use, so even in postmenopausal women, they can increase your risk of developing lupus, but they don't necessarily make lupus worse. So that is reassuring. So if you already have the diagnosis of lupus and you have mild lupus, you may still be a candidate for oral contraceptives or estrogen therapy, depending on what some of your other risk factors are. And we've talked a lot about UV light exposure, and Dr. Leatherwood talked about making sure you're getting enough vitamin D for your bones. So here in New England, we all are, many or most of us are at risk for vitamin D deficiency. And in fact, when we routinely test people in clinic for vitamin D levels, a majority of people have low vitamin D levels. That's really even worse in the lupus population because we're so busy telling you to avoid sun, to wear sunblock, stay out of the sun. And one of the ways we get vitamin D in our system is through sunlight exposure. So lupus patients tend to have lower levels of vitamin D. And there was a lot of excitement about this in the last 5 years, 10 years, a lot of research trying to explore whether or not low vitamin D levels themselves contributed to people's risk of developing lupus or making lupus worse, because we knew patients with lupus had lower vitamin D levels. And unfortunately, there's been no conclusive data or no conclusive conclusions on whether low vitamin D actually contributes to lupus disease activity. However, having said that, there's some thought that low vitamin D can contribute to patients. Not only do we need the vitamin D for our bones and to make our bones grow, but it can contribute to patients feeling fatigued. And so we really try to make sure that patients are getting adequate vitamin D, not only because it's good for their bones, but also because it may help a little bit with the fatigue that many, many lupus patients experience. So this is some information that Dr. Kostenbader published a number of years ago. But this is looking at a bunch of studies for the risk of lupus in current smokers. So as you can see, what this just means is your risk, everything to the right means that you have increased risk. And these are all different studies that have shown that if you're smoking, you have a greater risk of developing lupus. So we want people to quit smoking because it's not good for their heart or their lungs, but we also want, in particular, lupus patients to quit smoking because it increases their risk of developing disease and disease activity. We know, for example, lupus skin disease can be triggered by cigarette smoking. So for many, many reasons, people who have lupus really should try and quit smoking, which obviously is a very hard thing to do. Someone had asked about I believe about the Roxbury Lupus Project, and this was a project that grew out of the observation that certain neighborhoods in Boston, Roxbury, North Dorchester, South Dorchester, and Mattapan seem to have a higher incidence of lupus. And so a bunch of people in the room, Dr. Maserati, Dr. Kostenbader, were part of this study. Gail, I think, or there may be some people who were, certainly people in the room who participated or were aware of it. And the original thought or idea was that perhaps some of the location of these areas near some toxic waste sites were actually contributing to the development of lupus. And while that wasn't exactly what was found, what was established was that exposure to silica, which can be in certain factories and certain types of work, that silica exposure increases your risk of developing lupus. So what this means, like with 5 years of silica exposure, you have 5 times the risk of developing lupus. So I think what we can say about how to put all of this together is, and what we've learned from research, is that you may have a gene, and it could be one of 50 or probably more, or one of hundreds of genes, and that predisposes you to the risk of getting lupus. But that's kind of not enough, because not everyone who has those genes will go on and develop lupus. But then you get exposure, like maybe it's cigarette smoking, maybe it's silica, maybe it's the estrogens, maybe it's some UV light, and that some combination of these things disrupts your immune system, and then you go on to develop lupus. So it's what we call multifactorial. So when patients will often come in and you'll be seeing someone and they've just received the diagnosis of lupus, and sometimes people will say, well, I'm not surprised, I have an aunt and 3 cousins who have lupus. But most of the time patients will say to me, I don't understand how I got lupus because no one in my family has lupus. And that's because it's not just the genes, it's all these other things that are contributing to you getting lupus. Okay, so you've come into someone's office, you've just been given the diagnosis of lupus, and most of us, all of us as human beings, when we find out a diagnosis, we all get very worried. And so the first thing that happens is if you have access to a library or to an internet, many of us will go online and read everything we can about lupus. Or, your best friend will say to you, well, my third cousin's aunt's sister-in-law has lupus and they're on dialysis and in the ICU. And you're like, you're terrified. And we think often of diseases as diseases being progressive. So we have this idea, you get a diagnosis and it's going to progress to some bad state, or if you don't get treatment, a certain type of treatment, it's going to progress in the way that we think about cancer. So I actually took this slide from a slide on colon cancer where you think about cancer stage 0, stage 1, 2, 3, 4, and that's what many people think of about lupus. But it turns out it's not really the case. Lupus really isn't, for most people, progressive. So if you come in with mild lupus, when I say mild, more like you have very easy to control symptoms. Maybe you have some skin rashes, maybe you have some abnormal blood tests. You may always stay in that range of lupus. There are other people who come in and they may come in with kidney disease and they may have severe disease, but people tend to fall into categories. So I found this slide. So it's sort of like you could have little lupus where you don't have many symptoms. Those are so cute. And then, or you could have big lupus where you have a lot of symptoms. But it's not necessarily that this person's going to turn into this person. So it's more that you tend to be in your little range of symptoms of lupus. Okay. Oh, and then the other thing is that's hard for people to understand is that flares occur. So it's not like you come in, we get you under control, and that's going to be it forever. Sometimes you may flare and get worse. And this is actually the U.S. economy. But I thought that was such a nice, see? Up, down, up, down, up, down, up, down, up, down. But that's a little bit what lupus is, right? Sometimes you're feeling great, and then sometimes you're not feeling so great. And each person is an individual with how often they flare and how bad their flares are. So it's really hard to predict who's going to get flares or not. And some of the research has tried to predict that. Like, can I see a patient in my office now? Can I do blood tests and figure out who's going to be flaring in June? Because that would be great. Because if I could figure out who's going to be flaring in June and I could treat them, that would be awesome to prevent that flare. And we've been pretty unsuccessful in doing that. This recent study, though, looked at 120 lupus patients, and what they showed in this study, and this isn't going to hold true for every patient, but in this study, patients who had an increased level of their double-stranded DNA and it was associated with an increased risk of flare. Dr. Maserati, who's going to speak after me, is about to start a study at the Brigham in which she's looking at these complement components that are bound to cell in people's blood, and they're going to try and look at that to see whether they could predict from those levels which patients are going to flare. So what they're going to do is be collecting both blood samples and clinical data to sort of figure out who flares, who's not going to flare. And I think it's this kind of research. This type of research is going to help us understand who flares and can we predict flares. So the 3 areas of highest risk for poor disease outcome are, so here are the areas that we as rheumatologists worry about for patients' long-term prognosis the most, and that's the risk of cardiovascular disease, the risk of infection, often due to the medications we're putting people on to control their immune system, and lupus kidney disease. And I'm only going to talk a little bit about lupus kidney disease because we don't have time to go through all of this, but some recent research on that. So up to 60% of lupus patients will develop kidney disease, and as Dr. San mentioned, and what we see when we see actually the pediatric patients who then transition to us is many of those kids have presented with kidney disease, so there's a higher incidence in children. 10 to 30% of all patients with lupus kidney disease can progress to end-stage renal disease. And if you develop lupus kidney disease and lupus end-stage renal disease, this has huge impacts on healthcare use, productivity loss, and survival. So this is a big public health issue that we need to address. And Dr. Kostenbader and Dr. Feldman have been very interested in this. This is a study that Dr. Kostenbader did. And what you can see is that the incidence of end-stage renal disease is, so if you look here, is much higher amongst African Americans. So for whatever reason, African Americans have a higher risk. If they develop kidney disease, they're more likely to progress to end-stage renal disease. And another way of looking at that is this is the standardized incidence of end-stage renal disease among Black and white women ages 20 to 39. And look at this, 29-fold increased risk, 35, or 10 times the amount, 10 times the amount. So we've not improved this in that decade, because that's 10 times that, and that's about 10 times that. So we don't completely understand the reasons why, but this is what we're seeing. And in this recent study that also came out of Dr. Kostenbader's research group, in this study, those who were Asian and Hispanic had a lower incidence of end-stage renal disease mortality. So their mortality, their risk of dying was lower than whites. But Blacks had a higher risk of dying from end-stage renal disease than whites. So twofold risk here. One, developing end-stage renal disease if you have lupus nephritis, and then subsequently dying from that end-stage renal disease. That's a big problem that we need to explore further and we need to address. And now I'm going to switch gears and just end by talking a little bit about pregnancy in lupus patients to show you that some of the stuff that we've learned, and although this is an old study, this has been repeated in a subsequent study. And basically what this is showing that people who have women who have lupus who become pregnant have a much higher risk of developing high blood pressure, intrauterine growth retardations, and cesarean section rate than women who don't have lupus. So lupus, if you have lupus and you become pregnant, for many women it's a higher risk pregnancy where there's a risk of their disease flaring, but also there's a risk of them having pregnancy complications such as premature deliveries and small babies and C-sections. Having said this, I will say that we've done a better job, that we've improved our outcome in pregnancies in lupus patients over the last decade. We're not where we need to be, but we have improved the outcome. And I also wanted to tell you, this is sort of a paper that's hot off the press. Oh, yes, sorry. This is just to say maternal complications. I'm sorry. The disease flares during pregnancy are found by the number of flares before conception, blood count abnormalities before conception, low complement levels, and any history of kidney disease. So we tell our patients who want to get pregnant, we like to have them see, in general, a high-risk obstetrician, and we like to have them have their disease under control for 6 months prior to getting pregnant. And also, the important thing is that disease has to be under control in medicines that you can take during pregnancy, because you can't take all medications that you take when you're not pregnant when you're pregnant. You can take a lot of them, but not all of them. So that's what we counsel our patients. And I just want to end by showing you a paper literally hot off the press. It just came out. It's not even in print yet. It's online. And this is looking at racial and ethnic disparities in pregnancy of women with systemic lupus. What this shows, this is looking at information from insurance claims. And it compares pregnancies amongst women. So all these women that we're looking at have lupus. Well, first what it looked at is that women with lupus pregnancies have higher pregnancy complication rates than women who don't have lupus. So we've already established that, and it's the same complication rates that we talked about. But in this study, what they showed is that Black and Hispanic women with lupus had higher than expected rates of preeclampsia, preterm labor, and fetal growth restrictions. So I wanted to conclude by saying that lupus is caused by genes, environment, and hormones. There are racial and ethnic differences in disease outcome, especially when we start looking at kidney disease, and it looks like more recently pregnancy. And that's something we need to figure out why that's happening, and it's a problem we're going to need to address and solve. And yeah, so that's what the future goals are. So I will stop here, and I will take any questions if we have time.